May I come in?
How?
Assalamu alaikum.
Take your seat.
Thank you, sir.
So, you're ready?
Yes, sir.
Tayari shari ki hai?
Yes, sir.
Feel comfortable, and then if you feel you're comfortable, introduce yourself to all of us.
My name is Saida Shakilawan. I hail from the district of Hushab. I was born in Sagoda and spent early years of my life there. During my school life, I was awarded gold medal as well as a mention on the Roll of Honor board. After this, I completed my MBBS degree from Shifa College of Medicine, Islamabad. During my college life, I actively participated in community medicine activities. There, I developed an interest in public health, and moreover, it broadened my horizon in context relating to the present and prevalent problems in Pakistan's community. Therefore, I started pursuing a career in civil service. Hence, however, during my house job, I was a frontline worker against COVID, and this further enhanced my leadership skills, my community interaction, and further developed my interest towards civil service. So as soon as I was done with the house job, I started pursuing this. And to add my interest, I would like to add on it that my interests are traveling. I like to explore new places, reading, as well as journaling and volunteering work, I would say. Thank you.
MashaAllah. Good. So you want to join federal services?
Yes, sir.
The groups of choices you have given.
Yes, sir.
You tell us something about Pakistan, how you will describe Pakistan.
So Pakistan is a very beautiful country. It originated in the name of religion as well as created for a particular group of people. It's blessed with diverse landscapes. It's blessed with lots of resources and also human power. And inshallah, it will aspire to be a leading nation in the future as well.
What is the population of Pakistan?
Sir, it's around 23 million.
What is the area of Pakistan?
Area, sir, I don't...
Which supreme law is regulating the state of Pakistan?
Sir, it's the Constitution of 1973 that is regulating.
You tell me, what is the name of oath of doctors?
Sir, that is the Hippocratic Oath.
Yeah, kitab?
Hippocratic Oath.
Pura padho sir, sunao mujhe. What is the meaning of that Hippocratic? Hippocratic Oath hai.
So basically, it is the oath that doctors take, which is to serve the people, the selfless serving of the people and or the community.
Where it is the name Hippocratic Oath? Why?
Sir, I'm not so sure why.
Okay, give us an overview of health sector of Pakistan.
Sir, Pakistan's health sector, I would say, is comparatively it's less compared to other countries of the world at the moment. Because of the spending of the government, it's only 1.2% of the GDP. And the workforce as well, if we see the number of doctors and nursing staff as well as dentists, it's very limited compared to the population it has to cater. Similarly, the hospitals, especially at the district level, I would say that they are not well equipped with facilities, and also they are not the well-trained staff, especially in the rural areas. Other than that, we can see the COVID example. During COVID, Pakistan's health sector performed much better than some other leading countries. So that would be an overview.
Saida, you are the district health officer of District Hushab, and I ask you to improve the primary healthcare system. Now you tell me what you will do. What will be area of your interest? How you will improve it?
Sir, I would say, first of all, The number one thing I would focus upon is the awareness. Because people in rural areas, especially in Hoshav, they don't have much awareness regarding the health. So the number one thing I would focus upon is awareness of the prevalent health diseases, and especially some simple diseases which can be catered at the very basic health units. However, people are reluctant to go there to visit the doctors. So that is the very first thing. Second thing, sir, I would focus on is the training of lady health workers, or the staff, the lower staff at the low level, which basically caters and educates the people at home or administers vaccine or such type of things. So we can train them or in a better manner, equip them with more medicines as well as good training, so they can cater to awareness as well as other things like especially polio vaccine. Other than that, the Hoshav district also, if particular to Hoshav district, we can see that maternity issues are also very much high. So I would request some good gynecologist doctors or the particular to that field to visit that district, or because not much senior doctors visit especially the rural health centers or the basic health units. So we can form a plan or formulate a plan so they visit on some weekly basis or so to cater such women issues. Other than that, I would start a campaign for the vaccines of infants, neonates, and children who are under 5. So to complete their EPI schedule, that should also be focused. Similarly, I would request the commissioners or the administrators of the area to provide connectivity. That's also an issue in that district, because many people fail to reach hospitals, especially who live in the mountainous terrains, and they have difficulty reaching the hospitals. So we could also focus on that.
What is the population of Hoshav district?
Sir, it's around 1 lakh. I'm not sure, sir.
How many tehsil are in this district?
Sir, there are 4 tehsils. One is Hoshav, second is Qaidabad, third is Noorpur Thal, and fourth is Nowshera.
Any idea how many basic health units are there?
Yes, sir. I had studied that, but sorry, I don't recall it.
You got your degree from a chartered university, that is Shifa.
Yes, sir.
Now you tell me, under what law nurses get their nursing certificate or degree? LHV, lady health worker, gets some certification from some authority, under what law? And then midwives, they also get certification. From which authority they get?
So basically, Pakistan has a Pakistan Medical Commission. Before that, it was Pakistan Medical and Dental Council. That's a regulating authority for doctors, nursing, and...
Nursing authority is different. PMDC, the Pakistan Commission is different. Nursing is different.
Sorry, sir, then I will look into it. I don't recall it at the moment. Sorry.
Thank you.
Foreign service is your second choice.
Yes, sir.
So define diplomacy.
Sir, diplomacy, I would say it's an act by which foreign policy is conducted. It's basically a method through which foreign policy objectives are achieved.
What types of diplomacies are there?
Sir, there are 9 tracks of diplomacy. There are 9 tracks of diplomacy. Track 1 is when government to government diplomacy happens. Track 2 is when business community diplomacy happens. So similarly, there are other groups, for example, social media, they can do diplomacy. There are other certain groups which also do diplomacy.
Customs is your third choice. What can you tell us about the working of the customs department?
So custom departments basically is present at all the areas such as airports, the naval ports, the in immigration areas, in the border areas. So they operate there. They basically check the inbound and outbound people's luggage and different orders which are going through the ports and airports. So they basically regulate those things.
What do they do exactly?
So they tax basically. It's a taxing system. For example, if the inbound port has a particular order coming through, so they regulate the taxes of those
Duties.
the custom duties.
Jakindra Arjun is your favorite personality.
Yes, sir.
Why?
So I was inspired by her personality. She was a young female who became a prime minister in New Zealand. She had a vibrant personality. She actively participated in the world politics at such a young age. And the way she dealt with a few incidents that led me to get inspiration from her, especially the New Zealand Christchurch incident which happened. So
then okay, fine. Then why did she resign from her office?
So it's a reality in today's world that still women who are in higher places, they have to face certain issues, they have to face certain criticism. So being a female leader, she faced certain criticism as well. She had a lot of opposition from her own country. So she resigned because of pressure she had.
She should have stood her ground and faced those challenges boldly, bravely.
Yes, I agree that she should have stood her ground and faced the challenges.
How do you see the current political situation of the country?
Right now, Pakistan is going through a tough time, especially since the last year. The political situation is not static. Therefore, it has further led to a lot of issues, especially the economic turn down and other problems which are going on. The rise of terrorism we have seen. So, Pakistan's political stability is not very firm, I would say, at the moment. But inshallah, I hope that it goes to be a better. It improves on it. I would.
What leadership skills you have?
Sir, even during my school, I was part of host teams organizing different events. So I would say that I have a good communication skills, especially with my teammates. I have a good experience in organizing different events, different campaigns, different medical camps. Then some community I had when I was doing community work in community medicine. So interaction that's important. Otherwise, I would say I also have empathy during patient treatments. I have also learned that.
What were the 18th and 21st amendments in the US Constitution were?
Sorry, sir, I don't recall it at the moment.
Right.
Saida,
Yes, ma'am.
you were just talking about Jacinda Ardern. She's your favorite personality. And yet you think she didn't do it right. Then why is she your favorite?
Ma'am, during her tenure as a prime minister, there were some incidents, there were some of her works which led me to get inspiration from her. And her resignation is basically just highlighting the reality of the modern world, that still women face opposition and criticism at higher levels. So otherwise, her personality in itself and her some of her actions led me to inspire her.
So tomorrow, if you join the government service, you will be criticized, as government is always criticized. what would you do then?
Inshallah, ma'am, I would